What are the signs of head trauma? In any abusive head trauma case, the duration and force of the shaking, the number of episodes, and whether impact is involved all affect the severity of the child's injuries. In the most violent cases, children may arrive at the emergency room unconscious, suffering seizures, or in shock. But in many cases, infants may never be brought to medical attention if they don't show such severe signs of injury. In less severe cases, a child who has been shaken may have lethargy, irritability, vomiting, poor sucking or swallowing, decreased appetite, lack of smiling or vocalizing, rigidity, seizures, difficulty breathing, blue color due to lack of oxygen, altered consciousness, unequal pupil size, an inability to lift the head, an inability to focus the eyes or track movement. How is OT diagnosed? Many cases of OT are brought in for medical care as silent injuries. In other words, parents or caregivers often won't say that the child has a shaking injury, so doctors don't know to look for subtle or physical signs. This can sometimes result in children having injuries that aren't identified. In many cases, babies who don't have severe signs may never be brought to a doctor. Less severe signs such as vomiting or irritability may go away on their own and can have many non-abuse related causes. Unfortunately, unless a doctor has reason to suspect child abuse, mild cases, in which a baby seems lethargic, fussy, or perhaps isn't feeding well, are often misdiagnosed as a viral illness or colic. Without a suspicion of child abuse, and any resulting intervention with the parents or caregivers, these children may be shaken again, worsening any brain injury or damage. If shaken baby syndrome is suspected, doctors may look for hemorrhages in the retinas of the eyes, skull fractures, swelling of the brain, subdural hematomas, blood collections pressing on the surface of the brain, rib and long bone, bones in the arms and legs, fractures, bruises around the head, neck, or chest. What are the long-term effects of OT? What makes OT so devastating is that it often involves a total brain injury. For example, a child whose vision is severely impaired won't be able to learn through observation, which decreases the child's overall ability to learn. The development of language, vision, balance, and motor coordination are particularly likely to be affected in any child who has OT. Such impairment can require intensive physical therapy and occupational therapy to help the child acquire skills that otherwise would have developed normally. Before age 3, a child can receive free speech or physical therapy through state-run early intervention programs. Federal law requires that each state provide these services for children who have developmental disabilities as a result of being abused. After a child turns 3, it's the school district's responsibility to provide any needed special educational services. As kids get older, they may need special education and continued therapy to help with language development and daily living skills, like dressing,